Welcome to the live hangout of Global Public Health. We already have the first question for Mr. Rob Yates, who is joining us from UK, and he will be answering questions on health systems and, in particular, health systems financing and health economics. So the first question asked by Shiva Prakash is, how climate change will bring malaria to temperate region of the world, and how susceptible is the population at this region? I'm not sure this is a very related question to health systems, but would you like to have a go at it?
Social determinants. These are very relevant issues that we always have to be looking at. Public health, individual health, and the importance around climate change, affecting a number of factors that directly affect how human beings, like pollution, to flag that one thing that I think as a means to increase funding for health sector reforms. So I feel this is one area we keep up with climate change colleagues to both reducing climate change and improving health services. And then, so I should say, well, good afternoon to everybody. We're having a slight technical difficulty, and then the questions read out to be very good. Because the IT is working particularly well in London this afternoon. So bear with us, and we're looking forward to a fun afternoon.
All right, thank you. The next question up on the platform is a question by Raghavendra, who says, I have a health finance innovation and analysis of best practices that reduces NCDs. Please let me know the contacts to discuss the innovation. Any thoughts on that, Rob?
So innovations in NCD finance.
Right.
Yeah, sure. If you'd like to contact me directly, I'm quite happy to share my email address to all of us. It's Rob Yates, @gmail.com. So that's Rob Yates, one word, ROBYATES 123 @gmail.com. I'm happy to write it to enter into email correspondence to quickly refer Rajendra onto and World Health Organization, because they're very interested in health finance. So we'll be delighted to hear about what ideas you have. In today's
Okay, great. So I think another question that comes up a lot on the forum is dealing with universal health coverage, and as you said, that the best way to do this is through public financing. And so a question is on how to bring about a change from private insurance to public financing. What are the steps to be taken for that to happen?
Sure, that's a very, very good question. At the end of the day, this is the way that health finance reforms are operating across the world. And really, I feel this is health financing universal health coverage is to replace private voluntary financing, when mechanisms are people paying user fees and private health insurance, to a system which is more dependent on public financing, where people pay into a pool are allocated according to needs. This is a fact because it's really the only way to support healthy and wealthy people across subsidized sick and poor people. And it's been shown across the world that the free market will never achieve this. So you need a very strong role of the state to ensure that this happens. And really, because this is state forcing people to do things that they might not necessarily want to do themselves, seeing this as an inherently so I would say that how you one to the other, it really is through political action and really mobilizing the communities to lobby their politicians and the media and demand it. And smart politicians will recognise this as a good thing to do in terms of securing votes. So I would say that the main activity around ensuring this is through more political activism, obviously using evidence, but that's going to be your better politics.
Right. Rob, there's been a few questions about the chat not being very audible, your voice not being audible. So could you just increase the volume on your side a little? Or
yes, I'll do my best. I'm going to talk a bit longer and into the microphone. Is that better?
yes, that's perfect. Well, yes. I think more questions are coming up now. There's another question which is quite unrelated, but goes like, can there be prediction on how climate change can change patterns of, say, disease spread or vector development?
Yes, I believe it can. I think a number of people are modelling these changes as they see the temperature rising around the world. And I'm very aware that there are suggestions that there will be malaria into Southern Europe. I can't claim to be an expert in this particular area, but there are certainly, work and debate to model the impact of climate change on health indicators, particularly around the spread of infectious disease.
Right. One more question is about the political nature of health financing and how you mentioned in your lectures that it is a matter that needs to be dealt with the head of state and not the health ministry alone. So someone would like to know that what are the opposing factors that come into play while trying to enforce universal health coverage?
A very good question. As I mentioned, that to get universal health coverage, you really need to put healthy and wealthy people who cross-subsidize the sick and the poor. So that really means for those people, they'll be spending more on the health system than they'll be taking out. Now, people will try and resist this, and you see this across the world. That wealthy people want to create their own health insurance schemes that exclude sick and poor people because they know it won't cost them so much. But because creating a public financing system often increases the purchasing power of the government purchaser, that some vested interests, say in the medical profession and the pharmaceutical companies, won't like this because it impacts on their profits. That they aren't able to make so much money when they're dealing with a centralized payer. So you do find that there are interest groups who often try and undermine this progress towards universal health coverage. And perhaps the country in the world that exemplifies that the most is the United States, where billions and billions of dollars are spent really lobbying politicians not to if the money is spent on stopping gun control in the United States. So it's a lot of money is spent lobbying against moving towards universal health coverage.
Right. Another question that has come in is that while the NHS is facing a lot of financial difficulties, how can a model like universal health coverage, which also needs public financing, be looked at as a sustainable model for a country like India?
Yeah. Excellent question. Thank you very much. And I think that it is true that all health in the world do struggle with issues of sustainability because really as populations grow older and healthcare needs increase, it will be the case that countries have to spend more and more money on health. And this is something that we as a society have to grapple with. That as we live longer and we have higher expectations of being able to continue to lead independent lives, it's going to cost more money to do that. So what you find is as countries develop, they actually spend more money as a proportion of their GDP than poorer countries. So I think that countries like the UK, which is spending about 9% of GDP in public health financing at the moment, we have to recognise in the future that that proportion is going to creep up. But obviously you don't want it to get too expensive and too inefficient. But it is undoubtedly the case that it's actually cheaper for society as a whole that it's publicly financed. And it's a mistake to get to, say, a public health spend of 9% and say, oh, we cannot any longer afford the National Health Service in the UK, because if you then take more private financing, it will cost you even more. And you see that in the United States, which is mostly a privately financed health system, they're spending 18% of their GDP. So the most sustainable system is actually public financing.
Right. So I think we have another question here, which says, in a country where there is no public, sorry, I think we're facing some technical trouble here again.
Oh, yeah, I'm sorry, yes, I think my video image just frozen. I'm not sure if that's having any implications.
Well, at least we'll continue with the audio for now.
Sure.
And the question is, in a country where there is no public health service, how does the community organize themselves to have access to health services? That is, the context is Africa here.
Right, yes. And yes, this is very difficult. I was just visiting Malawi last week in Southern Africa, where public health spending is very low, mainly because of the weakness of the economy. And it's obviously very difficult to build universal health coverage when public health financing is very low. But it is possible, and I think there are very good examples of countries that have used their public financing very wisely in Africa. Thinking of Rwanda and of Ethiopia, that have invested heavily in community health workers. And I think this is one very good way for countries to build up, but based on primary healthcare services provided through community health workers and health centres. But really, it ought to be possible that with government financing and maybe some donor support, that basic package should be available to everyone free of charge. And I would say it would be a mistake to expect the local population to pay for those services.
Right. Another question that's come up is what is the best method of policy making and financial management in a low income country where there are lack of resources and money?
Yeah, it's very important to be as efficient as possible. And this is often a part that we forget, that we must get more help for the money that you raise. And I think that it's vital in a low-income country to obviously maximise the share of the health budget from the government. And if aid financing is being provided as well, to ensure that these financing mechanisms are complementary and that, say, donor project financing isn't spent wastefully. So the best way really is to have a strategic planning exercise where everyone brings their money to the table and one collectively plans the most efficient services to reach the maximum number of people with the most cost-effective services. And sometimes you hear this referred to as a sector-wide approach, where the donors and the government come together and then spend their collective money as wisely as possible. And some countries have done this very well over the years.
Right. There is an example from Germany where Carlos mentions that in Germany, the rich pay for the poor and the ill are covered by the healthy, and health insurance continues with or without employment. And doctors who are private providers make less money than before. Is this sustainable in all countries and leading towards universal health coverage?
Yes, indeed. The German health system is a very successful universal health coverage system. The German system, the correspondent correct says, more based on social health insurance, where people make contributions from their salaries into an insurance fund. But as well in Germany, the whole system is subsidized with tax financing as well. So what is quite common, in fact very common across the world, is that governments are mixing these socialized financing methods of tax financing and social health insurance contributions. So this is happening in countries like Ghana, Indonesia, and Thailand, and Rwanda. And it's a very good way to mix these systems. But of course, the important point yet again to emphasize is that they're compulsory and they're governed by the state. And this is a much better way of building an efficient, fair health system rather than a system based on private insurance where you don't get as much subsidization.
All right. Rob, more requests for your volume to be raised. So if there's any way to just maximize the volume on your PC. Yeah, I can. But I think we'll continue anyways because there are a lot more questions lined up. So another one question which I just got is how can private players be involved in UHC, especially in developing countries where public healthcare is not adequate?
Yes, that's again a very good question, and it's one that often comes up around the role of public-private players in the health system. And here I think we need to differentiate between public and private providers of health services and public and private financing. And certainly when it comes to the provision of services, there's nothing that's wrong with governments contracting with provided to provide health services to communities. And there are many successful health systems where a lot of the practitioners are actually in the private sector and enter into contract with the government purchasers. Well, that's very different to public and private financing, where I think, as I was saying, that public financing is much better than private financing.
Right. So another question is, what can be done to attract the attention of policymakers towards universal health coverage or towards a public financing system?
Again, excellent question. And I think that we need to be thinking about how we market UHC rooms to governments. Now, obviously, we need to emphasise the health benefits that by investing in the health sector, that people will live longer and healthier lives and be more productive. We also need to emphasise the economic benefits, that this will be good for the economy and for growth and for jobs. And the Ministry of Finance is likely to like those arguments. But perhaps the arguments that we don't use enough, but are likely to be the most successful, are that we should emphasise the political benefits of investing in health services for universal health coverage. And helping politicians recognise that this will make them very popular with the electorates and therefore more likely to be re-elected. They will get more votes if they do right by the health system. And in the UK, we have a general election coming up next Thursday, and the future of the National Health Service is the #1 issue with the political parties and with the population. So we in the UK, when it comes to elections, the politicians have to remember how much we love our National Health Service, and this is a very good way of securing resources in the future. So I would very much recommend that countries try and politicise the importance of universal health coverage.
Absolutely. A question just came up was, how can promoting health be made an element of foreign policy?
Yes, very good question again. I think you are seeing an increased interest in this issue of promoting health and universal health coverage in terms of foreign policy. Because I think this can be a very good way for countries to help each other. And you should look out for a special edition of the Lancet journal coming out on May the 9th, which is going to deal with global health security. And we have a paper on global health security and universal health coverage. And one could immediately think of an obvious link in terms of tackling pandemic disease and how we saw the world respond quite vigorously to the Ebola crisis in West Africa. And the world has already spent billions of dollars in trying to ensure that we don't see the spread of pandemic diseases. And this is also going to be very important for things like multi-drug resistant tuberculosis, that we help each other, countries help each other to tackle these issues, and how this is good for the world whole. But as well, I think there's an issue around helping fragile states to improve services for their own populations, to bring stability to countries. And again, that I think that powerful countries and richer countries can help developing countries to reach universal health coverage. And this is a good way to bring around more harmonious societies that are more peaceful societies as well. And I think you're seeing a number of governments now recognizing the value of universal health coverage in their foreign policy dialogue. And the two countries that have most recently said this explicitly are Japan and also China. And China has now said it is wanting to help countries reach universal health coverage. And we're hoping that Britain too is going to get more engaged in these debates in the coming months.
Absolutely. Another question that just came up on the chat is from Africa, saying that how best can we change the view of health in developing countries from a commodity or a privilege to that of a human right?
Yeah, excellent question. And this is the key thing. And what we're seeing now are people fighting on a number of fronts, maybe through legal mechanisms, to ensure that the right to health is enshrined in the Constitution, like has been achieved in Rwanda and in lots of Latin American countries as well. So one can, through legislation, make sure that people get the health services they need. But also, I think thinking about using mechanisms like the media to expose situations where people are being denied health services. There's one particular human rights abuse associated with the right to health that is really quite shocking, that I think we should be making much more fuss about. And that is the situation where people are detained, in other words, they're imprisoned in health facilities because they can't pay for the user fees. And this happens particularly with women who have had cesarean sections to save their lives, being detained for weeks, if not months upon end, because they can't pay for their health care. Now, this is obviously an outrageous human rights abuse, and I think that we should be putting pressure on governments to ban this practice. But in doing this, I should say, that it becomes more obvious that people having their rights to healthcare are infringed. So I think we need to be clever about how we politicize this and raise the rights issues through the media and through political activism.
All right. Another question that keeps coming up in different forms is, can India afford universal health coverage? And how does one go about doing that in such a country?
Yes, it's definitely can. But no shadow of a doubt that India could afford universal health coverage, and really, with all reference to colleagues there, that it should be doing a lot better than it is doing at the moment. India is one of the lowest spenders in public health in the world. I think it's now in the bottom 5 when it comes to share of GDP allocated to health at around 1.2 or 1.3%. And it's surprising for such a vibrant democracy that there hasn't been more pressure on governments to increase public spending. And you've only got to look at countries like Sri Lanka and Thailand that have made huge progress towards universal health coverage much earlier in their histories, when they had lower resources than India has now. So, for example, Thailand reached universal health coverage when its GDP is about $1,900 per capita. Now, India isn't far off that at the moment. I don't know the exact numbers now. But you can see that India really ought to be doing a lot better. And you might remember the expert group of the high-level panel advising on universal health coverage in India that PHFI was the secretariat of, and really showing that by doubling public spending, India will be able to take a giant leap towards universal health coverage. So therefore it is concerning that public health spending continues not to rise in India. And really it will only be through political pressure on the government to increase public financing that India will be able to make that move.
Thank you. And I think we're going to wrap up with a few more questions. One of which is, how does free trade agreement affect health and universal health coverage? Example, the agreement between Europe and the US. What is the effect on the European Union?
Yes, and we need to be very vigilant about these so-called free trade agreements, because there is a major danger that the main players determining what the rules will be the big pharmaceutical companies, the big insurance companies, the big private healthcare providers that maybe want to cream up contracts. And that often, as I was describing before, some of these big, powerful corporate interests are not working towards the equitable universal health coverage that we would want. So we have to be very careful that these free trade agreements aren't changing rules over things like intellectual property rights. It means that medicines become much more expensive to the world population. And there is a major concern that some of these trade agreements will result in an increase in the prices of medicines and commodities and equipment, which will adversely affect access to healthcare. So we in the health world need to get very engaged in the debates around these to mean that the health to right becomes a greater priority than increasing profits for corporations.
Another question that has come up is, what is your opinion of the role of world media or social media in influencing or pushing for public health initiatives or influence decision making for universal health coverage?
I think it can be really profound, and I think that we're perhaps only really scratching the surface of its potential at the moment. Because through things like social media, it's a very quick way for politicians and the media to be aware of what the population thinks. And when one sees big debates these days on things like Twitter, where people are able to comment on things and to state their preferences, you see that health and access to healthcare figures very high on people's needs. This recent consultation taken by the United Nations about what people want out of the SDG process, health came second to education of what people want across the world. And interestingly, when it came to looking at the wants of people in developing countries, actually health came top of all the list, above jobs, above security, above governance and corruption. So this is a very effective way for the population to really politicize the lack of access to healthcare. And one would hope that in countries like India, where there is a very poor, I would say, access to healthcare at the moment, through social media, the population should be making their opinions clear.
Right. One more question from Kashish Singh is, why or how do you think that developed countries can provide solutions for countries like India, given different population dynamics, along with the fact that many of these developed countries are having trouble providing healthcare to all of their citizens?
Yes, excellent question. And I think that this is where countries really can learn from each other, but everyone should recognize that every country is unique in terms of their history, their institutional arrangements, their politics, their burden of disease. So it's not really a matter of just taking one model from one country and imposing it on another country. And some countries do something better than others. So, for example, I would argue that the way that the UK and lots of Scandinavian countries raise money for their health sector, largely through general taxation, is a very good system. I would say personally that's the best way to raise money for the health system. But the Americans might do a better job of spending the money and getting good prices for providers. And here, for example, I'll give you the example of Japan, which is very, very efficient in the way that it spends its money. So one might want to look to the Japanese for tips on how to get maximum value for money. Another example, countries that have done very well in health management information systems. The country of Estonia has done very, very well on health management information systems. I think it's true to say that British National Health Service has not done at all well when it's come to information systems. So I wouldn't suggest looking to the UK for examples on how to manage your information systems. But countries like India, for example, I think should look around the world and see what fits best in your context. But I would very strongly recommend that when it comes to financing the health system, that India doesn't look to the United States and to a managed market of private health insurers. And I think that most people in the United States would say that this is a disastrous way to finance your health system. And I know this is a big debate in India at the moment, and I would say that India would be much better advised to follow a UK financing system rather than a US financing system.
All right, Rob. Another question says the population in countries like India, China, and Nigeria, are they a major threat, or do they hinder universal health coverage, or is that not a factor that plays a role?
It's surprisingly, it's not that much of a factor. If you've got these big growing countries are also massively growing economies that have potentially got lots and lots of resources that they can spend on their health system. So, for example, China is now the second biggest economy in the world and will soon be the biggest economy in the world. And as it has had this spectacular economic growth in the last 20 or 30 years, has been able to move from a system of not having quite low health coverage to very high health coverage because it's been able to use public financing. And the Chinese have spent over $160 billion of tax financing to increase coverage from about 10% to over 95% now. So the fact that the country's big doesn't necessarily mean that it can't afford universal health coverage. In many respects, it's quite the contrary, because you then potentially have the resources in the economy to pay for it. And really, I would say that India should try and learn some lessons from China on how to use its growing economy to increase health coverage.
Okay, Rob. I know you've gone through this in detail in your video lectures, but there is still a lot of questions on sort of the best buys or the best practices for healthcare financing for best results.
Yes, sure. And how's the value about it? How the value come down?
I think they have, but it should probably be better when it's broadcast on YouTube, and the volume should be fine then.
Right. Because I'm shouting so loud, I think everyone in our street. So, extra listeners in London this afternoon. So the question about the best buys, that's a very good question. Because I think think the world is learning the best thing with universal health coverage in terms of improving health indicators, improving the political factors as well, is obviously to try and cover the entire population with a package of cost-effective services. And there are many tables showing what are the best public health interventions. There are some very obvious ones around immunising children and stopping people from smoking and encouraging people to take more exercise and have a healthier diet. There are many examples, even things like controlling traffic to stop road accidents. It's so much cheaper to stop road accidents happening in the first place than building expensive trauma centres to save people's lives who have been injured. And these are the best kinds in primary healthcare services and in curative services that have an impact on people's health. And clearly there are some areas of health expenditure that we should not be spending public money on, things like cosmetic surgery, where, you know, if people want to adjust the way they look, they should be able to spend their own money on that. But we shouldn't be expecting, unless of course it's a very difficult medical condition, but just we need to be very careful to maximise the health benefits from public financing we have. And this will be a mixture of looking at the technical considerations of where you get the best health outcomes, but involving the population in those decisions as well.
Right. A question of my own, Rob. Well, is tax financing the best solution, or would it be something to do with, say, reducing fuel subsidies like in Indonesia, or a combination of several methods of public financing?
Yes. More and more countries are recognizing that it's a good idea to mix mechanisms to try and increase health financing. It must be said that where you have a large proportion of people in the informal sector without regular jobs, it is essential to have a big element of tax financing to cover that population. It's very difficult to take insurance contributions of people who are not in regular employment. So I would say that every health system in the world will require a large element of tax financing. But if you can also take social health insurance contributions from those in formal employment, then that can be a good idea as well to add to those resources. Also looking to tax things like cigarettes and alcohol and things that are bad for people's health, and be really innovative as well about how one raises taxes, maybe on things like allocations of money being remittances. That's what I was thinking. Remittances from abroad is a way to bring in extra resources as well. So what countries are doing are mixing these public financing mechanisms and trying to put all the resources into one big pool. And then again, this is one way to increase efficiency, is to reduce fragmentation and move to more of a single payer system.
All right. You mentioned tobacco, and there have been a couple of questions on taxation of tobacco, agriculture, on tobacco use, and using that as revenue for public health financing.
Yes, that's a very good idea, because obviously you have the dual impact of increasing revenues for the health system, but also reducing the prevalence of people smoking. And we know that smoking, of course, is terrible for people's health and is a huge drain on health resources. useful in increasing taxes on tobacco to fund the health sector. Obviously, though, this shouldn't be the only mechanism because, if one is really successful in hiking taxes on tobacco, then consumption will go down and therefore potentially the amount of revenue will go down. So this is just one mechanism that can be used. And I think the primary reason really for taxing tobacco very much higher than it is at the moment is to stop people smoking and therefore to improve health indicators.
Right. One last question before we wrap up is, what is the impact of pressure from other countries or say international organizations like the WHO on increasing spending on health, especially in low and middle income countries? And what is the response to outside pressure? Does that help, or is that not inconsequential at all?
Well, I think it's the international organisations, I think, should be very much working with with governments and populations, really to help governments themselves achieve what they set out to do. So every country in the world now has signed up to a resolution of the United Nations to bring about universal health coverage in their countries. And in many situations, it's now been written into the Constitution as well. So you can see it's the country's own decision that they want to reach universal health coverage. While I think organisations like the World Bank and the World Health Organization have been extremely useful in recent years, is showing all the evidence from around the world that the only way to reach universal health coverage is through public financing. You will never do it through private financing. So, therefore, logically, working with governments to say that, yes, if you want to achieve universal health coverage, the only way you're going to achieve this is through public financing. So, how can we help you to maximise your public financing and spend that money very efficiently? And this is the type of technical assistance that these organisations are providing now. Help countries devise financing strategies that will take them towards universal health coverage. And I think it should be much along those lines of encouragement and helping political leaders recognise that in doing that, it will improve their political popularity and will be good for them, their governments and their countries, rather than pressurizing them and making them do things they don't want to do themselves. And I must say that there has been a history of that before them, that about 20 or 30 years ago, the World Bank applied very heavy pressure, particularly on African countries, actually to reduce public financing and increase private financing through things like user fees. And I think this was really terrible development policy. And I think to some extent we're paying the price for this to this day. And I think we should learn from those lessons that whereas 20 or 30 years ago we were pressurizing governments into doing things that were actually bad for universal health coverage, we should be much more humble now in the advice that we're providing and really be much more useful in providing constructive advice on how to reach universal health coverage.
Right. I think this is the last question that we're taking. And it says that now the world has crossed 50% in urbanization. What new things should be added or modified in existing health models in order to address massive urbanization?
Yeah, very, very good question. And of course, it again is going to depend from country to country on the economies of the countries and the disease burdens of the countries as well. And one can see that the move towards urbanisation can potentially have positive and negative impacts on universal health coverage and health systems. From a positive point of view, it potentially makes geographical access to health services and things like immunisation services that much easier. So it's easier to immunise urban populations and for people to get to health services and really maybe like specialised services if they get sick. But on the flip side, it might be easier for epidemics of new diseases to spread through urban populations. And everyone is very relieved that the recent Ebola crisis didn't sweep through massive urban cities like Lagos in Nigeria. And also, there are potential dangers of things like air pollution being bad for people's health in urban environments where there isn't sufficient safeguards for maintaining air quality. So I think that again it's a matter of looking at the changing burden of disease, the demographics of the population, and therefore adjusting one's health financing strategy and UHC strategy as the population becomes more urbanized, and also not forgetting the needs of rural populations where things like geographical access is still such a major problem.
Absolutely. So with that, we come to the end of this session, and I think most of the important points relating to health financing and health systems in general have been addressed very well. And I think we'd be happy to get more questions and answer them in later Hangouts. And thank you so much, Rob, for joining us. And we are sorry for all the technical difficulties in this Hangout. It's been quite a challenge to coordinate two different continents and manage a broadcast, but I think it's been great, and we've all learned a lot. So thank you so much for.
If I could just thank the audience, I don't know how many people we even have on tonight, but it's been a real pleasure to answer your questions. All been excellent questions as well, and I'd be more than happy to sort of continue through the website to answer questions on health financing, the universal health coverage. I hope you enjoyed the lectures. I certainly enjoyed giving them. And let's work together to increase public financing and political pressure to reach universal health coverage.
Well, a lot of people joined in, and I'm sure even more people will get to watch it as it will be broadcast. I mean, it'll be put up on YouTube for public viewing, so everyone will be able to see this. And we're very glad we could have your time, Rob, and thanks again for joining.
Excellent. Well, good afternoon or good morning, everyone.
Okay.